Welcome back to DSM video. Today we're going to be talking about dissociative disorders. Again, when I say today, that just means the same day. Just a Saturday, sitting in my room amongst a bunch of Legos. Here we got one right here. Little guy. Stormtrooper. Dissociative disorders. Here we go. So, we'll begin with depersonalization, derealization disorder. Let's see, that's number 15. 1-5. It's marked by periods of feeling disconnected or detached from one's body or thoughts, kind of these out-of-body experiences that you hear about sometimes. Symptoms, the primary symptom is really that distorted perception of one's own body. The person might feel like she's a robot or like in a dream, not really in control of their own movements. There's symptoms that include depression, anxiety, panicky. Sometimes these symptoms are really mild and just last for a long time or for a short time, and sometimes they do last for really ongoing periods of time, many years sometimes, leading to problems with daily function or some kind of disability. Treatment includes psychotherapy, cognitive therapy, medication, family therapy, creative therapies, and clinical hypnosis. Research has found that quick intervention following a traumatic event may be really helpful for reducing the risk of developing some kind of dissociative disorder. It's really getting in there before the trauma has time to set in. People have time to kind of develop these own things, whether they know they're doing it or not. Let's see, we're going to 16 now. 16. Got it. 16. So it's defined as mental illness that involves the disruption or breakdown of memory, consciousness, awareness, identity, and or perception. When one or more of these functions is disrupted, symptoms may result and one may be diagnosed accurately with this disorder. Let's see. Treatment includes psychotherapy, cognitive therapy, medication, family therapy, creative therapies, and clinical hypnosis. A lot of the same. You're going to find a lot of the same therapies apply. Really different for different individuals. Again, intervening quickly is shown to help to kind of delay or reduce or eliminate some of these symptoms that may arise before one has some kind of breakdown in memory. Dissociative trance. Here we go. 17. Got it. Dissociative trance is the category that's used a lot of times in kind of pre-modern, non-Western societies. Trance is the narrowing of one attention so that some things such as sight, movement, or even an outer reality just get placed right up front. The outside awareness is gone. Someone said, an adaptation with great individual and species survival value. It is not far from such non-pathological states as hypnosis and meditation. So symptoms of narrowing of awareness or immediate surroundings, or stereotyped behaviors and movements that you would see in someone in a trance that are experienced as being beyond one's control. Treatment may include hypnosis, which enables people to control how stress or other mental states affect their bodily functions. Psychotherapy, cognitive behavioral therapy is used. It's effective for some people. Current research has found that some people with undetected dissociative symptoms can function well at work or school. Really, a lot of these people may go unnoticed, and it's only close friends or family that are aware of a person's inner struggles or suffering with this disorder. So now getting to 18. This one is pretty common, well, at least in the eye of the public. This dissociative identity disorder, this is what's known as multiple personality disorder. There's movies about this. There's a lot of kind of myths floating around about what this is, or stereotypes about what it's like. But it's defined as a mental disorder where there's an appearance of at least 2 distinct and relatively enduring identities. Some people have up to 100. Average is about 15. Accompanied by memory impairment, as one person switches from one identity to another. It's just not explained by ordinary forgetfulness. The presence of 2 or more distinct personality states accompanied by an inability to recall personal information beyond what is expected from normal forgetfulness, a loss of identity related to an individual, loss referring to time, sense of self and consciousness, as multiple identities are inhabiting one consciousness. CBT is used, really a mix of a lot of psychotherapies depending on the patient, what's going to work, because a lot of things are going to be, some things are going to work for some people, some things aren't going to work. Eye movement desensitization and processing may be helpful. Medications can be used for comorbid disorders, targeted symptom relief such as anxiety or depression. Research on treatment effectiveness focuses mainly on clinical approaches. They suggest that a phased eclectic approach, so kind of this integrative model, is going to be really helpful. But still, a lot of empirically supported data is not in existence. It's not well described, and there's not a lot of consensus. There's a lot still to do on that. So those are dissociative disorders. Thanks for watching. Let me know what you think in the comments. Just kidding. I mean, you can, but I know not a lot of people are going to watch this. Maybe you will. Anyway, thanks for your time. Moving on.